There's expected to be 17,000 diagnoses of prostate cancer, and over 3,000 men die every year from prostate cancer. Diagnosing prostate cancer in the early stages opens up all treatment options to Australian men. For men with a more aggressive disease that's still localised, then they still have all of the treatment options for dealing with localised prostate cancer available to them. So those treatment options include radiation therapy, and that can be delivered as either external beam radiotherapy or through brachytherapy, either high dose or low dose rate, or with surgical resection of the prostate, a radical prostatectomy. From external beam radiation therapy through brachytherapy and surgery, the side effect profile changes, and that's a big factor in terms of the man making the decision as to which treatment to pursue. There are a number of forms of delivering the radiation therapy. One is external beam radiation, which has been used for many, many years, and that is radiation therapy directed to the prostate from outside the body. And that's a course of treatment over several weeks. Brachytherapy is another way of delivering radiation, and there's two forms of brachytherapy. There's high dose rate and low dose rate. Low dose rate is generally used for localised prostate cancer in men with a good life expectancy with less aggressive tumours, and that's the placement of radioactive seeds within the prostate. The aim of that is to deliver the radiation in a single treatment and confine the radiation dose to the prostate and avoid affecting the surrounding structures as much. Low dose rate brachytherapy for localised prostate cancer is a truly minimally invasive procedure in that no incisions are performed. The seeds are all inserted through needles. Many men can be treated either on a day-only basis or a single overnight visit, and their return to activity is extremely quick. They're back to normal within a few days. High dose rate brachytherapy is generally used for more aggressive tumours, and that involves the placement of needles into the prostate and the delivery of radiation, some radiation dose through radioactive wires that are run through those needles. It's generally given in association with a component of external beam radiation therapy. So surgery is a procedure whereby the whole prostate is removed, and the aim there with the surgery is to remove the cancer within the gland, and the bladder is then joined back down to the urethra. It's a major surgical procedure which can be done as either an open procedure or robotic assisted, which does aid in recovery. The long-term risks with surgery primarily are effects on urinary control and on erections, both of which can usually be dealt with post-operatively. There's no urgency to treat prostate cancer generally, and all of those factors regarding the pros and cons of treatment need to be considered before a decision is made. Those advantages and disadvantages should be discussed with the patient, and the patient then should be left with that information in order to make their own decision as to which treatment best suits them.